Good evening, and welcome to Join the Discussion, a monthly show about senior health and wellness. My name is Madelene Francese. I am the Vice President of Marketing and Development for Heber Senior Care, and I'll be your host tonight. Thanks for joining us. Tonight's guest is Denise Peterson, the new President and CEO of Heber Senior Care. And tonight we're going to talk about what makes a transformative leader. Well, the recipe for Denise is quite clear. 1 cup nursing, 2 cups healthcare administration, and 4 heaping cups of the patient experience, quality programming, financial planning, and vision. Denise has worked in many large acute care facilities throughout the state, and she has more than 35 years experience as a healthcare executive. Thanks for joining us tonight, Denise.
Thank you for having me, Madeline. My pleasure to be here.
Thanks for joining the community as well. I'm going to ask you right off the top, how do you define a transformative leader?
I think that's a wonderful question, and transformation takes so many forms when we think about the technology and transforming technology, as simple as our phone. I mean, years ago, you didn't live without how the iPhone really transformed the way we communicate. So a transformative leader takes a culture and provides that leadership, motivation, encouragement, engagement, to have the staff and employees think of ways to transform what they do every day. So we get so used to taking care of patients in the same manner every day, coming in, doing our job, doing it well, and providing compassionate care. But we really have to think, and I don't want to say out of the box because that word is used so often, but really to truly transform. So transactional would be something that's kind of done in the moment, maybe a new piece of equipment or technology, but transformational leaders really transform the culture into thinking differently and supporting them when they take the risk to do that.
So what kind of characteristics or qualities, how do you, people, like you said, transformation, people use the word all the time. So how do you know you're a transformative leader or not a transformative leader? Are there certain indicators that transformative leaders have in common that you've seen throughout your career?
So I think it's about execution and deliverables, but I think what really makes a transformative leader is one that can really engage the people that work for them, because change is difficult for everyone. And in healthcare and change are synonymous now. Anyone who goes into healthcare, the world is changing in healthcare by the hour. So it's hard to keep up. So how do you engage and motivate people to come in every day and to say, let's think about doing this differently. Let's get excited about different ways to do things. And then when they internalize it and start to perform, and really then they come to and bring the ideas to you versus you trying to get it from them, you really know you've transformed the way people think and the ways that you deliver care by doing different things.
Is there a clock for transformation?
No.
I mean, I love it. I'd love to be able to set my alarm clock and say, on Tuesday, everything's going to transform.
Oh, I wish we could. I wish we could. It's not as easy as taking the iPhone.
So how do you measure it, and how do you know you're working toward, how do you know you see progress?
I think you do, but based on employee engagement, you really have to, patient satisfaction, your quality outcomes, your turnover, and we're a big business, so the financial and the streamlining or redesigning the way you do your work through lean processes to be more efficient so that you can then be profitable. So there's many ways to measure it in terms of engagement, patient satisfaction, outcomes, and that the bottom line is ultimately really the bottom line.
Right.
And showing that you can really, if you take, surgery is always a good example, and the complexity of from the time you register to the time the patient is actually discharged, and really look at those processes and really think of some transformative change that can make it better for the patient, the organization, the employee, the physician.
Did you always want to work in healthcare?
I've always wanted to be a nurse. I think I was in third grade.
From a young age? Oh, really?
When I decided that I wanted to go into nursing. And, you know, a cute story was when I was 16, I went into a convalescent home and lasted a half a day, and I left, and I said, I can't do this. I'd never really had an orientation, and I was crying. It was a traumatic experience, but I ended up going back.
Why? What was traumatic about it? Was it the population?
There was no, I was just, here's your job, and you walk in, and I had never been exposed to sick elderly people before, and so it was very traumatizing for me. I had never seen the equipment or a catheter, and I had no support. So I wanted to provide that support for people going into healthcare. It's very important for me, and I just felt it was something that caring for other people was innate in who I was. And I went in 1979 to St. Francis School of Nursing.
Okay, and we'll get back to this more specifically, but it's sort of interesting to me that you've now landed at an organization specializing in senior care. Right. And that was your first experience in senior care. So we'll come around to that. But what would you say is the biggest change you've seen in healthcare since you've started in your career?
So there's so many changes that have happened in healthcare. I think the largest change for me working in healthcare is the transformation from years ago, and 35 years ago when I started, patients would have long lengths of stay. We didn't talk about finances. It was kind of hidden. The budget was hidden, reimbursement was hidden. There wasn't that, you know, we always took good care of patients and monitored quality. I think the business aspect and the technology transformation has been so significant, and people are living longer. We didn't expect to see people living, you know, the average age in our assisted living is 92.
Exactly.
And so therefore people are living longer, so the technology has advanced. And then our costs have gone up. So the biggest change is how do you reduce the cost, provide the high technology care that's so demanded out there, and have the premiums not be so high so it's not so burdensome for people. And I think there's so much going on in healthcare with genomics and really trending diseases and preventing disease. So now we're to the point where let's keep people well. Whereas 30 years ago, we were a hospital, hospitals existed and patients came, but we really didn't think about, well, what services can we provide in the community to educate them and keep them well?
So hospitals, in your mind, were almost more reactionary, and now healthcare has become more proactive. And so in that regard, what are some proactive steps that you even see yourself taking here? I know you've only been at Heber Senior Care, 7 weeks now? 7 weeks. Just big anniversary coming up.
Well, when you look at proactive steps that I think employers are taking is to keep their employees well. So what wellness programs can you do? What fitness programs? If you go into many organizations, you'll see, you know, little acronyms, take the stairs, or you know, here's our menu for lunch and here are the calories, and we're going to give you a free gym membership, and we're going to do a health screening day and a fitness day. And so a lot of companies are saying we've got to keep our employees well. And what hospitals are doing now is becoming accountable care organizations, looking at the
Talk about that for a minute. What is it for our viewers? What is an accountable care organization? This language gets thrown about a lot, and for the viewer and the consumer, it's confusing. So can we take a second there?
Anyone who's accountable, if you take the words accountable care organization, you're accountable for the continuum of care that you provide. And so you're really managing the patient across the continuum. So from the time that whether it's you have employed physicians and you're managing them with the physicians and partnering with them to keep them well in programs, or whether they come through your surgical services or come through your emergency room, but it's not episodic care, it's accountable care across the lifespan of that individual. And how are we accountable for their care, not just in that episode, but in their lifetime? So it's care for a lifetime.
So looking back 30 years ago, it really was episodic, you would say. And so part of the new accountable care, it isn't just about the financial component, but healthcare organizations almost own you, and own the good, the bad, and are supposed to manage that with you, correct?
Correct, correct. So now it's really helping communities, helping populations, looking at, you know, groups of diseases and wellness and comorbidities, and how to manage and care for people in a different way in their home or in the communities versus coming to the hospital. And you've seen that with urgent care centers. Urgent care centers are everywhere in the state.
Exactly.
And throughout the country. Before, it was go to the emergency room. You know, you have a fever, sore throat, you're going to bring your child to the emergency room. Now it's, let's talk this through telehealth.
Exactly.
You know, let's talk to the physician from your home and let me guide you through that. So those are some of the big transformative changes that have happened in healthcare. And if you look at the concierge physicians, you know, that's an opportunity for people to have someone who you can call to help you manage your health and wellness, because it can be challenging when you have a chronic disease or a diagnosis to really manage through the system, whether it's through pharmaceuticals, diet, exercise, and our initial reaction is always to call a physician.
Correct.
If you remember, I'm sure your mother, if you had a fever, oh, my daughter needs an antibiotic.
Exactly.
So again, changing, you don't need an antibiotic, it's a virus, but there are a lot of paradigm shifts in the way we've practiced healthcare.
Is it difficult for seniors to, or I should say seniors and maybe their children, to accept the paradigm shift? Because, you know, here's mom and dad, they're sick, and for example, say they're at the hospital at Heber Senior Care. Do children want to pull out all the bells and whistles for their parents? And
yeah, I think what's true, what I feel is so important is that the families are very involved in their care, and they want to be, and so they should have the opportunity to stay with their loved ones and really partake in that care. And what happens is you give up so much when you go into an organization. You're so vulnerable. But most often I find that patients know more about their disease in the family and how to care for them sometimes than we do, and we want to take over.
Yes.
And we need to collaborate and partner. And I can say that because my son has type 1 diabetes, and if he were to be hospitalized, he knows more about his diabetes and control in his pump than even I do, because he lives with it every day. So let's partner. You know, unless he were, God forbid, you know, a patient is in a situation where they can't advocate for themselves, but it's become an integrated partnership with the physician, with, you know, physician assistants, nurses, physical therapists, occupational therapists. It's the whole integrated team.
Exactly, because I know we had a situation where we were trying to have a patient, he wasn't sleeping well, and what we learned was he never slept well.
Right.
He didn't sleep at night. He slept at different times of the day. It was his baseline.
Right.
And so I think, and maybe you can comment on this, the advantages to going to a place that specializes in senior care than going to a big facility necessarily if you don't need an emergent visit.
Correct.
Is that they can take the time
Correct.
to treat you as an individual.
Correct.
You want to talk, I know I'm skipping ahead a little bit, but I know you've come to Heber Senior Care because you heard about something that excited you. So talk to me and talk to our audience about this.
Absolutely.
Please.
So Madelene always talks about, you know, we have specialized care for children, and in the state there are 2 hospitals that just provide care for children. Hospitals provide care to a multitude of age groups, from teenagers, from adolescents, all the way through geriatrics. What excited me about the opportunity here with the hospital and the Senior Alliance is that we would care for seniors, people 65 and older, and really focus in on the needs of that population in a way that is individualized and concentrated for them. So again, if we want to call this a boutique hospital setting, so that geriatric patient that comes in has all of the services through the continuum, and the room is geared towards their needs. So for example, you know, the phone and their vision, and having large numbers, and having you know, a comfortable bed where a family member can stay with them with a chair next to them.
That's great.
In a large room, you know, the bathroom so that they're handicapped with walkers, and really providing all of the services, from the dementia care to the daycare to the assisted living, to really provide that comprehensive care for that elderly patient versus kind of getting lost in the system. Now, we don't care for all diagnoses. We don't care for all illnesses, and we certainly in emergent situations don't have the equipment that a hospital does. But for the chronicity of illness, that elderlies from chronic obstructive lung disease or congestive heart failure or diabetes, hospice care, respite care, we can do that and do it in a way that no one else can in the state.
So what makes this facility and this hospital different? I know you've focused on some of the conditions but how does
because
it
that's what we're
operationalize?
focused on.
So someone needs hospitalization and it's an emergency. Obviously you call 911. This is not about an emergent care situation for this hospital. But you're in your physician's office, you have 102 and a history of COPD, and they're not sure. They need you to be looked at. The breathing's a little concerning. Your fever's not going down. That's the kind of patient that this hospital would focus on.
Yes.
So it's, in a way, it's treating people with chronic conditions,
Correct.
as you stated.
Correct.
And that's sort of the change in healthcare. People used to pass away from these chronic conditions. They were sort of acute.
And I want to also talk about the behavioral health unit that we have, not only at Heber Senior Care, but in the Alliance. So we have almost 50 beds that really take care of our elderly patients. As you think of behavioral health and mental health needs, as you get older, your needs become greater. And the support that we can give that is really specialized in just that geriatric population versus being on a unit where there's a wide range of patient ages with the exception of adolescents. And I think that Heber Senior Care has done a fantastic job with the behavioral health patients and then getting them into programs to help them manage their life day to day and their families. It's a huge challenge and a huge burden.
It seems like it's an increasing problem as well, correct?
It is, as the average age in Connecticut and throughout the nation, as people are living longer, there is more dementia. There's more, or if you had some needs when you were younger and you're older now, your schizophrenia is still there and you need that help and support, but now you're 80, so there are other needs that you may have that bring in versus if you were 35.
So I would imagine also with a senior with a behavioral health issue, you spend a fair amount of time on medication issues, and just because the average senior, I think, takes 14 medications.
Yeah, I don't know.
Does that also impact why it's complicated at 80? I mean,
I think it's complicated because they may have other comorbidities going, medical problems at that point. So not only do they have some of the dementia issues, but maybe they have a colostomy that they can't take care of.
Got it.
Or maybe they've had a stroke, so they have a walker. So on top of some of the dementia and the wandering and the confusion, and then who helps them to organize their medication, their diet, and some of the more complex health needs that complicate some of that.
That's a terribly complicated problem. What has surprised you that hasn't occurred in healthcare? I mean, when you first started out in this industry, did you think, oh gosh, by then, 2018, for sure we'll have X, or we'll know why?
Well, I think that, again, the cure for some diseases, I was more hopeful that while we've made tremendous progress and they're making tremendous progress in genomics, I thought that there would be some more obliteration of some diseases that are still challenging to take care of for people. So while we've made progress, I was hoping that we'd have something magical to have a spinal cord injury patient be able to walk and to repair that, or to cure type 1 diabetes, or some of the cancers that are a challenge. We've come far in pancreatic cancer and other cancers, but we still haven't cured that. So there's still more work to do in terms of that. And again, as people live longer, but there's costs associated with the research that comes along with that. So I thought we would be further along.
I want to switch gears a little bit. When you read about your background and what you've accomplished, it is clear that you really have been at the helm of many service lines. and you have dealt with everything from orthopedics to emergency rooms to wound care to PICUs, I think you did. No, not PICUs. You did critical care. And when you read that part of your work history and you talk about it, making service lines run efficiently, effectively, and financially sound. And as I was reading this, I'm thinking to myself, you sound like an engineer when you approach this. So I want to back up and say, first of all, and ask you for our audience, what's a service line? How do hospitals know they need it? How do you evaluate service lines? And then what does it mean to run them effectively, efficiently, and in a financially sound way?
So a service line is a product that is across the continuum. I think the easiest service line for people to understand would be orthopedics.
Okay.
So if you look at the care of orthopedic patients, and I'll take specifically joint replacement, you look at that patient from before they even are, from the time they see whether it's their primary care physician or they get referred into an orthopedic surgeon and they're seen and the decision is made for surgery, educating them on that surgery, having preoperative classes, talking about what type of implant is best for you, planning that care, talking about what's your care going to look like after surgery, coming into the hospital to see the hospital, to meet the staff, to then coming in the morning of surgery to have that surgery so you're so prepared for it, you know what to expect. And a lot of times they will do strength training before you have that surgery. So again, that's one product. So if you looked at a hip replacement and you're looking at that across the continuum, and then the care after. So whether you go home with physical therapy, whether you go to some elderly people do need to go to a rehab facility and stay overnight with support services, and the follow through after. So it's following a product or a service through the entire continuum. And I know I've used that word a lot, but it's the continuum of care. And what you do is you streamline processes within that. So hip replacement in 25 years ago, you came into the hospital the day before and you stayed 7 days. And you had a shave and prep, and you had an IV, and you were NPO. You weren't sure what implant you were going to have. You met your surgeon the night before, you went to the OR, and then you stayed in the hospital for a week, and then you went to a rehab facility and stayed for 2 weeks, and you had physical therapy, and there wasn't an education class and information and packets of care. And then the rehab facility really didn't know what the hospital did, so there wasn't that connection. So now you're discharged to another facility, and maybe the physician has a pathway or guidelines that he wants certain things done that maybe that facility didn't know about, and so therefore the care is disconnected. So it's really connecting the care across that continuum. If that simplifies it, I mean, I think service lines are complex. A cancer service line would be one that's very complex because there's multiple components within the service line and the care in the continuum.
And how are you judging the financial viability of a service line? I mean, that's a toughie because you could be helping a lot of people, but if you're losing money, you're not helping your organization.
I think that's a loaded question. Yeah, one for another show that could take hours. But that's something that you would really need cost accounting system. You really need to analyze that. But if you look at the Cleveland Clinic and their heart hospital, the reason they're so successful is because they focused on a product that they do they're the best at. They do hundreds of thousands of cases, so they can negotiate lower prices for their supplies and their implants. So it's very complex. And I've had the pleasure of going to the Cleveland Clinic to see how they do it. And that is what they do, and their hospital is just dedicated to cardiovascular surgery.
That's a good lead-in, and if you can believe it, we're almost coming to the end of our 29 minutes. So I'm going to combine my questions. I know you only have just been in town 7 weeks, but I could tell by who you are as a person that you probably already have goals already for Huber Senior Care. And tied to that question, everyone would agree keeping seniors out of the hospital is the ultimate goal. So while talking about maybe your future vision for Huber Senior Care a little bit, how has the Connecticut Senior Hospital Alliance, how is it different for seniors and okay to come to the hospital versus that thought of keeping people out of the hospital for seniors? And does that tie to your goals moving forward with this facility?
So I look at the Alliance, I mean, we are in a hospital, but we're not a large teaching facility where you could kind of become one of 700 patients. You know, you're one of 50 patients that has more individualized, specialized care for your chronic disease process. And then within that alliance and system, we have services to help you along the way. So we support you when you go home or when you need to go to a long-term care facility or an assisted living facility, or you need services. So that's really what's different about being in a large hospital. Again, specialized on geriatric care, specialized on behavioral health and medicine, and really providing that almost that individualized one-on-one care that you can't get in a larger facility.
It's really the bookend to CCMC.
Yes.
It really
Yeah,
is. So, you know, everyone goes in the middle,
right,
which is great. And then when you need specialty services, both for children and for seniors, those are the bookends for healthcare in this system. So what other goals or what other vision do you have for this organization? I know I'm putting you on the spot, 7 weeks. But
well, I mean, the vision is really to reposition Hebrew Senior Care in the community, and to have people, a lot of people are not aware that we have the hospital at Hebrew Senior Care, and to really brand and to get the name recognition and partner with all the physicians in the community, partner with our acute care hospitals as well, and provide those services, and to really think about the future needs and how our population is growing and changing, and making sure that Hebrew Senior Care is positioned to meet those needs ahead of time.
Exciting opportunities, I think, await you. And I am very excited to hear what you have done and to have you come back. I've asked every guest the same last question because I have a theory that if you work in any kind of industry, you're always going to give your parents the inside answer. At least that's what they count on. So if your parents asked for 3 important healthcare tips, what would you tell them they are now? Or any senior listening, what would you think the 3 most important tips are for affecting maybe health and wellness?
Well, I'm a huge proponent of diet and exercise. So some form of activity, daily activity and exercise, really looking at, your diet and a healthy intake, and being proactive. If you feel that something isn't right, taking that proactive step to follow through and make sure that you have someone that you can call. So, it's the same for stroke. The sooner you can make that phone call, or you have that chest pain, and having that support system. But I don't know that there's any recipe for seniors for success, except a lot of it, I believe, comes from being happy and finding some internal peace, and surround yourself with family and love. Because there is no medicine better than the support and love of having friendships and good people to be around. So I would say that that's key, as well as some of the other things that we talk about. So a lot is that intrinsic happiness and satisfaction that you can have.
It's a great answer. I remember reading that seniors who are isolated, it equals 13 cigarettes a day in terms of effect and impact. So I know there's
pet therapy.
Oh, yes.
Really bringing people together. That's what I think. That's what I know we do at Hebrew Senior Care. Is bring that. We keep people happy and engaged and encouraged and meaningful. So whether it's being in our craft room or our therapy room, sharing thoughts and ideas with each other, but again, staying active, surrounding yourself with loved ones and friends is critical.
You're going to have to come back. We have talked up into the very end. I want to thank everyone for joining me. Thank you, Denise, for coming tonight. I encourage everybody, if you have a question for Denise, to please email me at join the discussion at HebrewSeniorCare.org, or if you have a suggested guest. Meanwhile, watch the show. Thank you for joining us. See you next month.
Thank you.